Well, a very good morning to you. It's good to see you on this Thursday morning. Hoping that you have had a better start to the day. If you are in transit, if you are already in the office, or if you are still at home, it's good to see you. Welcome to the show. My name is Winnie Lubembe, and the show is Your World. So today we'll be talking about hepatitis, all right? And I'm pretty sure maybe you can remember this from biology class, or because this is a conversation that we don't usually have on a day-to-day basis, but yet thousands or even millions of people are actually dying from this same. So this, even as we prepare for to mark the World Hepatitis Day, which will be happening tomorrow, so it's important for all of us to just be on the know as far as hepatitis, what it's all about, and what are some of the things that we can do to prevent. All right, so because as we all know, the liver silently, or if you didn't know, it actually performs over 500 vital functions every single day, and this is to keep us alive. So however, when the liver is inflamed or damaged, its function can be affected. And according to the World Health Organization, over 1 million hepatitis related deaths are reported every single year, and one new chronic infection every 10 seconds. So that is why the liver health is fundamental to human health. And as the world, like I said, prepares to mark the World Hepatitis Day tomorrow, that is 28th July, so then how do we prevent new infections and death? That is the subject of our conversation today. You want to stick around until the end of the show to understand more of this, I mean, even the liver function in itself. But let's take a look at some of these statistics. Like we said, 28th July 2023, World Hepatitis Day. And of course, the theme for 2023 is one life, one liver. But it also continues to say, we cannot wait. You need to know your status, because as we all know, we have like really bad manners, all right, as far as our health seeking behavior is concerned. We wait until we become sick for us to go to hospital. So know your status, very important. All right, so one of the fundamental questions, you know, very simple basic questions that people would ask is, so what exactly is hepatitis? All right, so it means inflammation of the liver at the basic level. All right, and there's five main strains of the hepatitis virus, referred to as types A, B, C, D, and E. However, types B and C are more common, and of course we'll focus more on the same in today's conversation. So what do the numbers look like when we are talking about hepatitis? So this is according to the WHO as well, where an estimated 354 million people worldwide live with hepatitis B or C. An estimated 58 million people globally have a chronic hepatitis C virus infection, with about 1.5 million new infections occurring per year. Okay, and of course the numbers continues to say that there are an estimated 3.2 million adolescents and children with chronic hepatitis C infection, and in 2019 approximately 290,000 people died from hepatitis C, and of course there are vaccines to prevent hepatitis A and B. However, currently, we do not have an effective vaccine against hepatitis C. So this again goes to show how critical it is for us to have this conversation as far as hepatitis is concerned. And again, like we said, even as we prepare to mark the World Hepatitis Day, which will be happening tomorrow, it is important for all of us to first of all just know our status. Okay, we do not have to wait until something hurts for us to go to a hospital. So are there screening services as well as far as hepatitis is concerned? We'll also be finding out from today's conversation, and I'm pleased to have Dr. Rupal Maru, who's a consultant physician as well as gastroenterologist from Kenyatta National Hospital. Gastroenterologist is such a mouthful, but it's so good to have you this morning. Thank you so much for creating your time really to just come and help us understand more on hepatitis, because like I said, this is not a conversation that we have on a day-to-day basis, but at the same time it is very critical because it affects millions and millions of people, and a lot of people dying. Like one infection after every 10 seconds, that is concerning.
It is.
It's very concerning. All right, but those are the global figures, but of course we'd be curious to understand, so how are we doing As a country here in Kenya, what do the numbers look like? And do we have like specific areas that have reported more cases as compared to the
yes,
others?
They are.
Yeah.
They are. So thank you, Wendy, for having me over.
Karibu sana.
Yes, we do celebrate World Hepatitis Day tomorrow, and it's a pleasure to be here talking about something I'm very passionate about.
Yes.
So yes, the numbers, fortunately in Kenya, this is nice to say that we're on a decline.
Okay.
We were at we're doing about 3% and probably less now. So the numbers are going down.
Okay.
But most of our statistics are related with patients living with HIV. So they're who are HIV positive and also have hepatitis B.
Okay.
So they're about 4.7%. So that's also a good number for now, because we at least know who the co-infections that we have with hepatitis B.
Okay.
So numbers are looking well. What have we done to achieve this? Is just screening, testing, and getting treatment.
Okay. And you say majority of the times we don't hear the information about go for your screening, make sure that you know, you get checked and all the. We don't hear a lot as far as hepatitis is concerned and screening and all those things. So I'm pretty sure lots of people will be curious to understand. So then how often should we go for screening? Is it like a once in a year?
No. So basically everyone who is above the age of 18 years currently living in Kenya should get themselves tested. Okay. Anyone at risk of getting hepatitis B, who are the people who are at risk? Persons with multiple sexual partners, person likely to receive a blood transfusion or will require chronic renal dialysis. So people working in the medical fraternity would all need to be tested. So any person at risk should be tested.
Okay. All right. And of course, we'll get more to understand. So who exactly is at risk and what exactly is the risk, you know, in itself. But how about we just go back to the basics? Because again, like we said, hepatitis this is a condition where the liver is inflamed. But how about we start from the basics? The liver, let's get to understand the functions. Because WHO says what? Over 500 vital functions?
Yes.
On one single organ?
The liver is very important.
Yeah.
So where is it located? First of all, it's at the right upper quadrant. Okay. Just below your rib cage, but it's covered. It's actually protected by your rib.
By the rib cage.
Yes. And it's like you said, 500 more functions. So it's there for your immune function. It's there as a hemopoietic center. That means you make blood from that center. It helps with detoxification. It has metabolic functions like glucose, carbohydrate metabolism, protein metabolism, fat synthesis. So there's a lot of hormonal function. It stores a lot of your micronutrients that are very important to you, copper, iron, you know. So I mean, just looking at all that, you can imagine how important your liver
really is. Yeah.
And to a gastroenterologist, that's it's the most important.
How good you would say? Okay.
Not to create a bias.
But yes. I mean, given the number of things that the liver does to keep us alive. I mean, yeah, I would agree with you on the same. And of course, given the fact that it does a lot to the body to keep us alive and to make sure that the body is functioning well, it's also at risk of developing, you know, scarring, infections, and all those things. Given what it does, and one of the things is hepatitis, right? And like you said, from the graphics, we have different types, like five different types of hepatitis. So could we just go through them? Because like we said, B and C are more common. A, not so much. C and D, more or less. I mean, D and E, more or less the same.
So basically, hepatitis A mostly happens during outbreaks. And it's fecal-oral. So we've had quite a few outbreaks in Kenya, in the coastal area, in Kisumu areas as well, in the past, and it was fecal-oral. So you get diarrhea, you get inflammation of the liver, you get jaundice. Good thing is it's an acute infection. What does acute mean? It's something that you get and will not progress to harm your liver. So it's self-limiting. You have a bad episode of GE, You get inflammation of the liver, and after that, if we give you the support, the liver comes back.
Okay.
Okay. So then what is hepatitis B, C? They're all chronic infections.
All right.
And our global burden with hepatitis B is more than C. And C does have a treatment option. So if you do get tested and you're positive, you can get treated.
Okay.
And you can get seroconversion. Hepatitis B, on the other hand, very difficult to treat.
Oh.
Right?
Okay.
You can only reduce the viral load, but there's a heavy burden of disease.
Okay.
And how are they how do you contract hepatitis B and C? Is by one, blood transfusion, sharing of needles, probably an exchange of body fluids, some more than the others, especially semen, vaginal fluids, that is higher risk.
Okay.
And breast milk, saliva is lower risk.
Okay.
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 So that's
but it could.
Yes, it could,
All
but
right.
lower.
Okay.
But that's with a person who already is a carrier for hepatitis B. And these are chronic infections. What does chronic mean? Chronic means when you've had an infection for more than 6 months, yeah,
All right.
you carry it, and then we're able to see that you have the virus. But it was asymptomatic. Chances are you didn't have anything. Or now you are having symptoms of yellowness of eyes, pain around the liver, mostly not feeling so good.
Yeah.
So that's B and C. Now, hepatitis D is actually a co-infection that's happening with hepatitis B, which if you notice a patient deteriorating or having decompensation, we would want to look for hepatitis D. Hepatitis E is also is one of the causes of chronic hepatitis, inflammation, but our biggest burden remains B and C.
Okay, all right. So we'll focus mostly on B and C today. And just in case someone is tuning in, so you said B and C are more of like viral infections, right? So where do we get it? And how do you, first of all, contract it? Do you, right? Because majority of the times when we think about like a viral infection, it's very easy for us to think, oh, the lungs, or right, but this is more on the liver, aspect of the same. So yes, can we just really get to understand? So where do we get these viruses from?
So the virus is basically is transmitted through carriers.
Okay.
Okay. So someone already has the virus.
The virus. Okay.
Then you either share needles with them.
Okay.
Okay. You have sex with them, or you get a transfusion from this person.
Okay.
Or you have contact with them of maybe non-sexual or sexual contact.
All right.
And this is how you would end up
getting the virus.
The virus.
Okay.
B and C.
Okay.
Hep A, I've already alluded. It's fecal-oral. That means you eat out somewhere and probably end up getting yourself exposed.
Okay.
So exposure is through those channels.
All right. Okay. So again, out of curiosity, so this carrier, right? Where do they get this virus from? Like, where does it originate from? Because it must have come from somewhere, right?
Yeah. So the hepatitis A is from the waterborne.
Yes.
Yes.
Yeah.
B and C are just hepatotropic.
Okay.
They came from somewhere.
Okay.
Yeah.
Oh, and then a person gets it.
And then the carrier has it.
Okay.
So how the carrier got it is just transmission.
Okay.
Through and through. Yes.
Okay. All right. So then, do we have specific symptoms that are for hepatitis B and C, or they're very
non-specific?
Non-specific.
Non-specific. You can't really know that if someone has hepatitis A or B or C when they present to you initially. It's only that the ones with acute hepatitis, which is where they've just got fever, general malaise, flu-like symptoms, and they come in, and then you notice that they have pain, little pain around the right upper quadrant here, and they've got yellowness of eyes.
Okay.
That's what we describe as jaundice.
All right.
Okay. And that is when you would want to now investigate this patient and do something called a liver function test, which will show me if there are transaminases that are elevated. Tell me there is a transaminitis, inflammation of the liver.
Okay.
Yeah, these are enzymes produced by the liver. That tells you that this is an acute infection.
Okay.
So a patient with chronic infection will just come in not really knowing, probably they got screened somewhere, but they haven't been feeling well, and they notice sometimes they have yellowness of eyes, sometimes they have some pain, but generally they are asymptomatic. They have no idea that they're carrying this virus.
Isn't that a risk in itself?
It is.
Right?
It is.
Because then if you don't know that this is what you have, again, transmission becomes, right,
Yes, yes.
faster and easier, and oh wow. So then for those ones who show the symptoms, is there a specific time that the symptom, and especially for the acute one, right? Because for chronic, like you said, they don't know that they have
They
have
don't
the
know.
disease.
They probably had a flu-like symptom. They didn't feel well. They got a little bit of yellowness of eyes, and then it just got better.
Yeah.
So they never really thought about getting themselves tested, or the doctor felt that this is, and they never really end up going to the hospital to say, listen, I need you to test me for this and this and that.
I mean, we don't do that. Majority of the people don't do that. We don't go to hospitals to get tested, just to get to see how we are doing. Are we healthy? Are there parts that we need to improve, or is there something that we need to be in the lookout for?
Routine checks is not happening.
Yeah,
it's not happening.
Yeah.
So what we're trying to say is look for any person above the age of 18.
Okay.
Yes. Who's never been tested for hepatitis. Let's try to screen them.
Okay.
So if you get a pregnant mother coming in, try to screen them as early in their pregnancy as you can.
As possible.
Yeah.
Okay.
So when you have a mother who has, when you've just had a baby, also test them. You know, try and have testing done as in those special population.
Okay.
Is very important. And anyone living with HIV, test them. Anyone who has, multiple sexual partners, let's get them to understand that they need to get tested and screened for hepatitis B and C, because co-infection has a poor outcome.
Okay. All right. We'll talk about the co-infections and the impact of the same, but going back to the fact that this person shows symptoms, right? And like you said, they're non-specific symptoms. It's very easy for it for someone
to ignore it,
right?
Yes.
Or because then it mimics other symptoms, so you may think, oh well, maybe this will pass, or you take the wrong medication for the same, right? we do that a lot, which really it's a very big problem. So how long do the symptoms last for those ones who show symptoms, or until you get help?
So basically anyone who's had like a flu-like symptoms and 6 months later they're still not feeling all that great, that just tells you there's something that needs to be done. Like I said, there's a test called liver function test, which guides us as the gastroenterologist or as a doctor, wherever you are, that there is something that's happening more here. And when you take a history which tells you, oh, this person has some risky behaviors, probably had a blood transfusion, ended up traveling to an area which is endemic for hepatitis B and C. So that already guides you that this may be a risk. So he may be at risk or has already probably got hepatitis B or C.
Or C, okay. And talk about endemic areas. Do we have like known endemic areas here in the country?
Yes, we do. So Northeastern, Migori, they're quite endemic as well.
Okay. Do we know why?
Probably because of lack of water in certain areas, probably the sexual practices in those areas. They do have like Northeastern, so multiple partners. So we can't really say, but some of those could be alluded to from there.
Okay, so again, going back to those ones who show symptoms, right? And then we ignore because ni homa too, right? So what happens in terms of like progression and maybe the damage that it could do to the liver or maybe
I said,
other organs?
I agree. So now what happens with that? If you've got chronic hepatitis B, like unless you don't get tested, you'd never know.
True.
So someday you'll just feel that your feet are swelling or your abdomen is swelling, and there's like you feel your liver is more heavier or giving you like pressure symptoms. And then you'll be like, oh, okay, maybe I need to see the doctor then. So there is a delay in when they come. Now, most of the time, that means something called liver cirrhosis has set in.
Oh, wow. Okay.
What is liver cirrhosis? Liver cirrhosis is where you have so much inflammation of the liver that it starts becoming shrinks.
Okay.
Yeah. So it starts shrinking and it's not able to do its job effectively
as it's supposed to.
Yeah.
Okay.
So that would mean you'd have accumulation of fluid in the stomach.
Okay.
Because it's not able to control that. You may have low blood levels, maybe. You may have hormonal changes. You may have metabolic disorders. So all that guides the doctor to say this. There's more happening here than meets the eye.
Okay.
Okay. So we'd have to do tests to make sure that we establish what stage they're at.
Okay.
Okay. And worst is that we develop something called hepatocellular carcinoma.
Okay.
It's a big burden. So quite a number of our patients end up getting hepatocellular carcinoma. Both with liver cirrhosis and hepatocellular carcinoma are big contributors to death.
Okay.
Okay. And they create a burden, disease burden, a health disease burden in the community.
Yeah.
And economically, because it's not, it's very expensive.
Yeah.
So it's better to test
as soon as possible.
As soon as possible.
Yeah.
Instead of having to be treating a patient with liver cirrhosis and hepatocellular carcinoma.
Because it's also more expensive, right?
It is, it is. And just not that, even your quality of life is poor because you're always having to visit the hospital, you always need to take drugs, you have loss of working days. So that all affects the economy at large.
That's true. That's true. Okay, let's take a break. But when we come back, we'd also want to understand. So fine, very concerning the fact that majority of the people would not have. I mean, they are asymptomatic, right? And then factor in lifestyle. So smoking, drinking, and all these other things that puts us at risk of other non-communicable diseases. Is that also one of the bigger contributors to more death and all those things? Because remember, like we said, our 500 vital functions that are done by the liver. So is this also like one of the biggest concerns that as medics you have? And if so, what are some of the things that we can do to prevent the new infections every 10 seconds and even death? But of course, we'll get to understand more on that after the break. So if you have any other question for Dr. Rupal, our numbers our lines rather are open, and use our social media platforms as well at NTV Kenya, both on Facebook and on Twitter. Ask your question away, and of course Dr. is here to answer all your questions. But all that is coming up after the break. Stay with us.
The Nuclear Power and Energy Agency (NUPEA) is a state corporation under the Ministry of Energy mandated with the development of nuclear power program for electricity generation in Kenya, carrying out research and development of energy technologies and capacity building for the energy sector. To this end, NUPEA coordinates all relevant nuclear infrastructure in the country. For more information, log on to our website and follow us on our social media handles.
sure you can think of a time when someone hurt or offended you and forgiving them was the last thing on your mind. Well, this week on Crossover, we have a conversation around love and forgiveness, especially forgiveness. Pale kwenye studio, we'll be joined by Pastor Yula Munguti, music kama kawaida, your favorite DJ, Son of Nations. I'm working in power. So save the date and join us this Sunday from 11:30 to 1 p.m. only on NTV. Know who I am. Tell a friend to tell a friend to cross over. I live a life of favor, for I know who I am.
Andriy Popovich was in a car crash today. He was the one driving. He's alive at the emergency ward.
I didn't want it to kill just anybody. It was supposed to be Andriy and Yana. Who died anyway?
How the hell could we have known that Andriy would survive that crash? That could all change. Maybe he'll be dead by the morning.
Something's wrong. Somebody help! 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 Somebody call a doctor here! Emergency! Doctor!
To protect our family from germs that cause illness when it's cold, we use Dettol soap.
Dettol soap with germ defense gives you protection. When it's cold, germs are transferred in different ways, and Dettol soap's germ defense protects you from up to 100 illness-causing germs. Be Dettol sure.
Centum Real Estate offers you an opportunity to own a home at the Two Rivers development. Mzizi Court residents, talk to us today on 0703 262626 or text 2 Rivers to 22365.
Right, welcome back. Glad you're still with us. The show is Your World. Wow. Okay, the show is Your World, and today our focus is on hepatitis and understanding hepatitis infection, because, like we said, 28th July, this is a day that the world marks World Hepatitis Day. And here's an interesting thing: is actually chosen because it is the birthday of the Nobel Prize winning scientist Dr. Baruch Blumberg, who discovered hepatitis B virus and developed a diagnostic test and vaccine for the virus. Isn't that interesting? Okay, all right. And of course, like we're saying today, majority of the people do not show symptoms, which is very concerning. And the fact that this is not a conversation that we usually have on our WhatsApp groups, family meetings, amongst our friends, we don't really talk about hepatitis. So it's a bigger concern and bigger disease burden as well, because it's a lot of people don't really know about it, or even how bad it can get if you do not get treated on time. But good thing is there are screening services available for hepatitis B and C, which is more common as compared to A, D, and E. So it is important for all of us to have that kind of information. But at the same time, remember how we were talking about yes, it is a viral infection. You also mentioned it's an STI. We don't talk about it as well. A lot of the time, we usually tend to ask, what is your HIV status? Yes. And that's it, right? But we also need to start, being a little bit concerned about hepatitis as well. But my question was on lifestyle. Yes. So does it also exacerbate the, intensity or putting one more at risk of hepatitis B and C as compared to the others?
Definitely does. So smoking and alcohol would worsen your progression, right, to getting liver cirrhosis and hepatocellular carcinoma, because they're known risk factors. So as well as obesity. So if you're obese, chances of you having worsening of your liver cirrhosis, which would lead to hepatocellular carcinoma, the risk is there. So, and hepatic steatosis, meaning you get fat deposition in the liver. So that's very important, that we stay away from junk food and eating foods that would over time would cause more deposition of fat in the liver. So they're very concerning, and yes, alcohol, smoking are
one of the biggest risks.
Yeah.
Okay, and so and we said earlier on, so if this is not treated sooner, right, liver cirrhosis, right, but then does it also affect other organs?
Yes, it does.
Of the body?
Hepatitis B can affect other organs like the kidney, so kidney for sure, and other organs as well. So, but we are worried about the kidney.
A lot,
With hepatitis, like I said, it gives you cancer. It triggers you to, get cirrhosis. But even the kidney starts getting damaged, so you get renal dysfunction. So you end up having to go for dialysis for that.
Yeah, and like we said, this is a chronic, so it's over time. Do you see instances where a lot of the people would come to the hospital complaining of their kidneys, only to find that the source was there?
Yes, we do.
Yeah.
So that has been our also concern, because and we need to, because by the time they're going in for dialysis, we need to know their status.
True.
Yeah. Both the HIV, hepatitis B and C, because once they get on the dialysis machine, this could also affect the rest of the patients using the machines, because like I said, exchange of blood may end up giving you transmitting transmitting hepatitis B and C.
Okay, all right. Can we talk about pregnancy as well? Pregnancy and hepatitis B and C.
Like we know, pregnancy is a beautiful state, but it's also an immunosuppressive state.
Yeah.
That means your immune system is not at its best during pregnancy.
Okay.
So what happens during, you can actually have progression of the disease. We know you had hepatitis, but it was there, quiescent. It was not really affecting you, but it can literally get really bad at that point.
Okay.
And you can have it being transmitted to the child. So mother to child transmission, which is also one of the reasons causes that you find.
Yeah. At what point does the transmission?
It can happen at any point.
At any point. Oh wow. Okay.
So during conception.
Yeah.
During as the baby is having, and at birth.
Yeah.
Yeah. And or breastfeeding. So if the mother has a very, very high viral load, and she got infected, and so that can happen.
That can happen as well, which is more concerning, because it could happen at any given point, and you might not be able to pick at what point.
Yes.
Yeah.
And that is why we've insisted that as soon as the mother, because we're saying with 6 weeks, by 6 weeks you should be attending your antenatal clinics. Within the first 3 months of your pregnancy, you should have had your first visit.
Yeah.
So screen them as early as possible.
Okay.
Let them know their status as early as possible, and it makes a huge difference.
Yeah. So then, what does hepatitis B and C look like, and especially in infants?
There's you can't really know, because they'll come in at jaundice.
Yeah.
The yellowness of the eyes, and probably maybe you'll see a normal size liver, you may see a big liver, you may see a small liver.
Yeah.
So you can't really, and that's on palpation. So we do an ultrasound to establish the size, to confirm the size, and if there is active inflammation, necroinflammation going on. So at the end of the day, you can't really differentiate between B and C unless you test.
Okay.
So you do serological tests.
Yeah, just get to understand
which one you're dealing with, B or C.
Yeah, okay. But are the symptoms more severe? Because I'm just thinking for this baby, infant, child, right? The immune system is still developing. And like you said, the liver also helps with the symptoms. So if they show symptoms, for those ones who do, if there are the symptoms more severe as compared to, adults who maybe have like a stronger immune system?
Definitely, because like they are born with their innate immunity. So their immune system is still not ready for all this. So yes, they can deteriorate faster. Okay. And these are the patients, once they've been born with hepatitis B or C, their lifetime risk of getting cirrhosis and cancer is much higher than someone who gets it at the age of 40.
Oh wow. Yeah.
Yeah. So there's a difference.
Yeah.
The impact is worse.
Yeah. In children. Okay. So then what exactly does treatment look like? Because then, for those ones who show symptoms, yes, now come to a hospital, you know, all this tests will be done to ascertain what exactly are you dealing with. Are you dealing with hepatitis B or C? But then for those ones who don't show symptoms at all.
So not everyone requires treatment.
Okay.
Okay.
All right.
So not everyone requires treatment. So we, what we do is do their liver function tests, see whether there is ongoing activity. That's by looking at the what we call alanine transferase, ALT, and AST.
Okay.
Yeah. So we look at those. Are those deranged?
Okay.
If the bilirubins elevated. Okay. So that's the liver function test. Then we look at the synthetic function. Is there a risk of them, you know, bleeding on themselves, you know, all that. And we do something called an abdominal ultrasound, the basics. And you need to make sure if they don't have any other co-infections, HIV. If it's B, do they have C as well? So we need to establish that. Then we do something called a viral load, in hepatitis B.
Okay.
And we look at something at the viral, how much viral load they have. And there's something called hepatitis B-E antigen, which tells you the level of viral replication at the level of the liver. So there's cutoffs. We have certain cutoffs that we use.
Okay.
Yeah. So if they're younger and we're noticing that there's more inflammation, then we would probably want to start them on treatment. If they're older, 40, but the viral load is, you know, acceptable, we monitor them. So every 3 to 6 months, we monitor them.
All right.
But there's some that we just need to put them on treatment because there is evidence of necroinflammation, liver cirrhosis. You don't wait. You start them on treatment.
Okay.
Some come in acutely decompensated, meaning the liver has given up. It's not able to do its work. So those ones you also need to put on treatment. Okay. So they are these antivirals that are available that doctors use, and we put them, and they're similar to what we use for HIV drugs.
Okay.
But HIV has 3 drugs. This one has 1 drug. It's normally 1, but if they have a co-infection, you just give them the normal regime that you treat HIV with.
Okay. All right. So this 1 drug, lifelong or
lifelong, based
lifelong.
on how they lose the hepatitis B surface antigen. So that is the first test we do.
Okay.
Yeah, where we test you for the hepatitis B surface antigen. So if you lose the surface antigen, we keep monitoring you, and after 1 year that you lost the hepatitis B surface antigen, we may, if everything is in order, we may, and most times we can get you off antivirals.
All right.
That means you have viral suppression.
Okay. So for them, in a case that you're monitoring the viral load, right? So again, what is it that this person has to do just to make sure that
to come and follow up with the gastroenterologist?
Okay.
Closely.
Yeah. Yes. All right. But then, so are there things that they could do? Lifestyle, diet, something.
Avoid smoking, avoid alcohol, avoid any risky behaviors that would, you know, and let them understand. They also need to tell their partners or whoever they're living with that they are also carrying the hepatitis B virus, so that they can protect themselves as well as the population at large.
Absolutely. Okay. So maintain sort of like a healthy lifestyle. Eat right.
Eat
exercise.
right. You don't eat low-fat food. You know, eat a healthy. Like, you know, I believe the Kenyan diet so far is really healthy.
It's good.
Like, eat like your grandmother.
Basically.
If you can eat like your grandmother, your liver's right. Drink lots of water. So
and you'll be okay. All right. But then, so how often should they come?
So basically, when we screen them and we see it, we decide whether we need to see them every 3 months, every 6 months, based on when they're presenting to us.
Okay.
So if you're presenting to me with liver cirrhosis that's already decompensated, where the liver is, you know, slowing down, then we'll need to see you more often. But if I've already got your treatment for the hepatocellular carcinoma, follow you up very closely, you know, and so you actually base it on how well they are.
Oh, it's individualized. It's not okay. All right. And for the testing as well, because like we said when we started the show, hepatitis B, I mean NC can be considered STI. Not can, is an STI, right? Amongst the other different ways that again one can contract. So once you test person A, and they are diagnosed with either B or C. So do you also do like contact tracing, just to make sure that, you know, everyone, especially for those ones with multiple sexual partners, just to make sure that, you know, they are also
we do
tested
advise the patient that
Okay.
do you know who your last sexual contact was? How many contacts have you had?
Okay.
Do you think that at any given point, do you feel that you contracted this from someone? Yeah. And they'll probably be able to think about it, and you know, and we ask them, can you please ask your partner first, current partner,
Yeah.
to get tested,
Okay.
and then maybe the one prior to that, at least to get themselves tested.
Okay.
And testing is important. So if they do turn out negative, what do we tell them? We need you to get vaccinated.
Okay.
Okay.
All right.
So hepatitis A has a vaccination, which you can get. Hepatitis B has a vaccination that you can get at 0, 1, and 6 months.
Okay.
You must get yourself vaccinated.
Okay.
And if you can do that, you have good protection.
Okay.
More
All
than
right. So
0,
0, 1,
0 at 0, T0, 1,
okay,
and at 6 months.
6 months. Okay. All right. So this is for
Hepatitis B.
hepatitis B.
Yes.
Okay. C, unfortunately,
No,
no vaccines.
no vaccines.
Okay.
Fortunately, there is treatment.
Okay. Which
Yes,
is good.
but
Yeah.
it's expensive.
Oh, unfortunately. I was like, oh, this is
No, it's
good. There
it's
is treatment.
treatable, but it's cost. There's a cost implication.
Yeah.
It's a big, huge cost implication. So would I want you to get hepatitis C? No.
No.
Don't get it.
Yeah. Yeah. Let's try it.
Prevention is better than
Let's try and focus on the prevention. Okay, so then, and speaking of this, so then what exactly does prevention look like when we're talking about hepatitis
Prevention
B
is
or C?
basically using a condom, yeah,
Okay.
getting yourself tested so that you know your status. That's first and foremost.
Okay.
For a mother to child, so you know you can choose your mode of delivery, or would you breastfeed your child, knowing your status, you know. Personal protective equipment, very
It's
important.
important, yeah.
Like for the doctors, we'd say wear gloves. First, get vaccinated if you're negative.
Yeah.
Get vaccinated. Use personal protective equipment, which is gloves. You know, whatever you need to do. Wash your hands thoroughly and regularly.
Yeah.
If you are always, touching things and everything. And pre-employment, while you're getting if you're going for a blood transfusion, get to know your status. Yeah. If you end up exposing yourself to like I said, like you go to an endemic area, yeah, and you come back and you suspect or you're suspicious of that, get yourself tested.
Yeah.
Yeah.
Okay. All right. And in those endemic areas that you mentioned earlier on, and you mentioned what we have like cases in Turkana, Baringo.
Yes.
You'd find that those areas, again, access to healthcare facilities is not
poor.
right.
Yes,
Is very poor. So then, what happens in such instances? Because, like we said, treatment can be expensive. There's low quality of life, as well.
Like you
so focusing on prevention, what exactly happens?
So like for them, washing hands would be very important.
Okay.
But again, in those areas, arid areas, the water resources are poor. Yeah, so that's already putting a challenge.
Yeah.
But we can do more by just creating awareness.
Okay.
Yeah, if we make them aware, I guess everyone would want to wash their hands.
True. True.
If you tell them that it's important to get tested because you live in an endemic area, they would agree. But then probably the facilities on the other side would need to also promote this awareness.
Yeah. Okay. I'm just curious, and especially with COVID-19, it brought about a lot of things, but one would also look at it in a different way, that some other infections sort of went down. So I'm just curious about
Hepatitis B,
Yeah.
we actually saw a decline at that point.
Okay. All right. Okay.
Like I said, initially we had the numbers. So we don't know whether it's because of COVID-19 or is it just that there was more screening and uptake of the vaccination as well, because COVID-19 did create awareness about vaccination.
Sure.
So I guess there was also this like, oh, if I can get vaccinated why not for this, take up hepatitis B as well. So I think it helped us open, awareness and acceptance into something that, you would ignore getting vaccinated.
True.
Why do I really need to, unless you're traveling.
Yeah.
Yeah, but most countries do recommend that you also know your status before you travel.
Okay.
So that if you've not been vaccinated, you should get your vaccinations prior to travel.
To travel, yeah, because again, you never know. You never know.
You never
okay,
know.
and we talked about screening as well, and probably someone is watching us and thinking, okay, so if I want to go for screening, is this available in public hospitals? How
Yes.
often should people go for screening?
So I like, it is available at Kenyatta National Hospital.
Okay.
We do provide all the services there, and all centers. Yeah, all VCT centers also do the testing for hepatitis B with HIV.
Okay.
So they've made it like part of their screening programs. So they are available at all.
All right.
And if not, they would probably forward you to the next center that is doing it. But
Okay.
you need to go to a center first.
Yeah, I mean, all right, free
Testing center.
right? Is it free?
Some of the centers is free, like the VCT ones. Some you have to pay a little, but I mean, paying that little bit just to get yourself tested, I mean, to know, I think that's more important.
Yeah, really is. It really is. Because like we said, we're trying to, not even just here as a country, but I think globally, we're moving towards preventive care as compared to curative, because again, I think curative has proven to be more expensive in all different aspects, whether it is the low, quality of life to the expenses, incurred during treatment. So prevention is much better. So, and this is a wake-up call to everyone, because like I said, this is not a conversation that we have on our WhatsApp groups.
I think after
your
HIV,
family members, yes.
this is the next thing we need to talk
we
about.
really need to.
Because
know
HIV
about.
and hepatitis B together are a disaster.
Yeah.
So we've tackled HIV quite well. So we still ongoing with it. Now hepatitis B is just as crucial.
And I'm just curious, and talking about HIV, and then maybe someone has hepatitis B or C, and they are not symptomatic. What exactly
So most
is that? How bad can it get?
So with HIV,
Yeah.
if you're already on your treatment, it will help.
Oh yeah,
with
it will help with hepatitis B. Okay.
Only that hepatitis C, you would require to be on a totally different antiviral that would help you clear the hepatitis C.
Okay.
So those are decisions the doctor can easily make.
yeah.
A gastroenterologist, yes.
Okay. So then, how do we reduce the disease burden? I mean, in the country, yes, and because, like you said, we've made strides. We're seeing a decline, but still there are cases. So how do we reduce this from becoming a disease burden? Because, like we were discussing this during the break, and we said, listen, if we're not careful, then this could be another.
It's about having the conversation.
Yeah.
Telling yourself this testing is important.
Okay.
Yeah. We've already said it here. Now we're telling you take this opportunity and understand that this is how you would be able to take care of yourself. So it's like how you you plan your finances, you should also plan your health.
True.
Yeah. Start early. If did I have a contact with someone that I'm not aware about their status? Yeah, was I helping someone take care of themselves? Probably someone had a road traffic accident and you were there helping, hold their wound, stop the blood from gushing.
Yeah.
Did I put myself at risk?
Yeah.
Ask yourself that. If I put myself at risk, and if I have, I need to take myself to get tested
as soon as possible.
As soon as possible.
All right. Because majority of the times, especially like with HIV, you'll be told, if you suspect that you were, at a point you were at risk, get yourself to the hospital within,
Yes.
certain hours. So I wonder if that is the case with hepatitis B and C.
You can. So you can get tested.
Okay.
You may be negative, but what you can do is the next 3 months you come back for a follow-up.
Okay.
So you're negative again. So that tells you this is what it is. But in case at that window period you did become positive, then the doctor the healthcare professional would be able to assist you on the next step forward. But sometimes you may be negative, but in the window period you turn out to be positive. So you seroconvert. But then again, you keep testing yourself.
Yeah.
Yeah.
Okay. All right. So let's talk about investments into this thing, because now if a bigger population is symptomatic, that is very concerning. So then how much of an investment should this be made into awareness, into maybe treatment for those that are available, for vaccines for hepatitis A and B, which are available, and invest more into treatment of hepatitis C, but most importantly, investing into the prevention aspect of the same.
I think the
from
biggest,
your perspective, yes.
Yeah, I think we should invest more in prevention than wanting to treat, because the cost of treatment, like I said, is not affordable for everyone. Yeah, and before you get yourself to the right healthcare professional, you may have lost a lot of time. So, if I had allocation, budgetary allocations, I'd still put my budgetary allocation the highest on the prevention, which would be the public health aspect, more than the treatment.
Okay, I see that. I want you to speak to the young population, because what we've seen now, and especially with the numbers with like HIV, 15 to around 24-year-olds are more at risk, right? And hepatitis B and C, of course, being an STI as well. I think this is something that we should be having more conversation with the same. So what is it that you say to, you know, the younger population who are like, listen,
use a condom.
See, there's a PrEP. Do you think that really works now? And especially the A part.
Abstinence, being faithful, C, use a condom. You know? It's important. You know, as much as they want to, okay, yes, you want to be sexually, you are a sexually active. They are
sexually active. Yes.
But then use a condom. Know your status. You know, know your partner's status. Just make it a rule, make it a habit. Just don't, you know, take risks.
Yeah. All right. And for those ones, again, who are more at risk, like we said, healthcare workers, people with multiple sexual partners, you know, and all those things, just understand the level of the risk, but most importantly, know your status, which again goes with the theme for this year. We've talked about investments and how important that is. We know how health is now a devolved function. So we say it's for counties to make sure that public awareness is more, right?
So it is very crucial. And like having like, thank you for inviting me again. So this is important. We should talk about what is important and relevant. I mean, and this should be one of our agendas in health, that we should tackle these.
Yeah. All right. And for hepatitis C, which there is treatment, right? So after treatment, what does it look like? Are there chances of maybe infection recurrence as well?
They can. There is a small chance it can, but most times you're able to clear it.
Okay. All right. Within how long?
12 months.
Oh, 12 months.
Yes.
Oh, okay. All right.
12 to 24 months.
Yeah, I was expecting you to say like 12 days, 12 weeks, 12 months. Okay. But also during this period, make sure that, you know, you also observe all these other things.
So you could be with hepatitis C, you're on treatment, but then you have risky behavior and you get yourself with hepatitis B. I mean, that's disaster.
Yeah.
Or you continue with the same behavior and you get HIV.
Yeah.
So you see, it doesn't help.
It doesn't really help. Out of curiosity, do we have instances where someone can have like A, B, C? Because now D and E are not as common. But do we have those instances where someone can be treated?
Hepatitis B, you know, showing up with hepatitis D, you know, it's because it's a co-infection.
Yeah.
So some of them like having hepatitis B and, you know, HIV, and then they get hepatitis A. That's possible.
Yeah.
It's not like it's not impossible.
Yeah.
But again, that just tells you that the level of understanding or the risk they're exposing themselves to is high.
It's high.
Because by the time they were diagnosed with HIV, they should have got tested for hepatitis B. They should have got their vaccination. And because they're at risk of hepatitis A, they should have also been vaccinated for hepatitis A to prevent them not getting more burden, disease burden. That's it. So if they were vaccinated,
you reduce the risk. Okay, so then we need to end the conversation like literally right now. So parting shot, what is it that you would say you know, about first of all the importance of the day, but awareness, like we have said, which is the most important thing in just understanding about hepatitis?
So I would love everyone and really request everyone to know their status. Tomorrow's World Hepatitis Day. I would like everyone to go get tested, screened for both hepatitis B, C, if you're negative for hepatitis B, please get yourself vaccinated. This is the sure way of you managing your health, your liver health, and it's important to us.
Yeah, I see that. Very, very important. All right, thank you so much, Dr. Rupal, consultant physician and gastroenterologist from Kenyatta National Hospital, giving us all the info we need to have. Really, this has been sort of like a learning, hour for all of us, and that is very, very important, because once we have the correct information, it's easier for us to take all the preventive, measures just to make sure that we know our status. Because as the WHO's 2023 theme, World Hepatitis Day, one life, one liver, we cannot wait. You need to know your status. So the ball is in your court. Thank you so much, Dr. Very, very informative conversation this morning, and I hope that you've learned a lot from Dr. as well. But again, if you still have more questions, our social media handles are at NTV Kenya, both on Facebook and on Twitter. Use them, and let's keep the conversation going. But for now, enjoy the rest of your day. I will see you next week on Monday. Stay safe. Enjoy your weekend. Goodbye.